Hi everyone, my name is Mackenzie and I will be talking about ethical dilemmas in nursing that we face. So first of all, what is an ethical dilemma? An ethical dilemma is a situation in which a nurse faces two or more conflicting moral principles, making it difficult to choose the right course of action. The importance of ethics in nursing. Nurses regularly make decisions that directly impact patient well-being. Ethical guidelines ensure care is compassionate, respectful, and just. The purpose of this presentation is to explore common ethical challenges nurses encounter, understand the underlying principles, and discuss strategies for navigating these complex situations. Principles of nursing ethics: autonomy, respecting a patient's right to make their own healthcare decisions; beneficence, acting in the best interest of the patient to promote well-being; non-maleficence, avoiding actions that could cause harm to; justice, ensuring fair and equal treatment of all patients; and fidelity, being faithful to commitments and maintaining trust. And all of these can be found on the ANA. Common ethical dilemmas in nursing can include situations such as end-of-life care decisions, patient confidentiality versus family disclosure, informed consent with incapacitated patients, resource allocation such as drug shortages or supply shortages, refusal of treatment by patients is also another common one. So for the first example, I have a scenario that deals with a terminally ill patient that is late-stage cancer requesting to discontinue life-prolonging treatment. The ethical conflict here is autonomy versus beneficence. Autonomy supports the patient's right to refuse treatment, and then, of course, beneficence is encouraging to continue treatment to extend life. The nurse's response would be to respect the patient's informed decision while ensuring they also understand their options, collaborating with the healthcare team to provide palliative care and emotional support, and then involving the ethics committee at your organization if that is deemed necessary. For the second example, we have a scenario where a nurse suspects domestic abuse during a routine examination, but the patient insists it not be reported. Now, the ethical conflict here is confidentiality versus the duty to protect. So confidentiality, obviously protecting the patient's privacy, and then duty to protect. We have a duty to report, and it requires intervening when there is potential harm. Nurses' response: document observations carefully and maintain an open communication with that patient. Assess the level of risk and follow institutional and legal reporting protocols. Engage social services or an ethics committee when needed. And then possible outcomes for this: mandatory reporting if it's required by law or your organization, and then provision of support resources while respecting autonomy as much as legally permissible. Legal and institutional guidelines. The role of the hospital ethics committees is to provide guidance in complex ethical situations and support interdisciplinary discussion. The Nurse Practice Act define the legal scope of nursing practice in each state and guide ethical conduct. Importance of documentation. Accurately and timely documentation protects both patients and nurses legally and ethically. And then consulting supervisors and legal advisors. So seeking guidance helps ensure decisions align with legal standards as well as institutional policies and guidelines. Cultural and personal values. Conflicts between personal beliefs and professional responsibilities. So nurses may face ethical tension when personal or religious beliefs differ from the patient care needs. And also, professional ethics require prioritizing patients' rights and well-beings. Navigating cultural sensitivities in patient care. So understanding and respecting diverse cultural backgrounds, this improves communication and care outcomes with patients. And culturally competent care involves active listening, empathy, and avoiding assumptions. Strategies for ethical decision making. So the 4-box method analyzes medical indications, patient preferences, quality of life, and contextual features. And then the ANA Code of Ethics offers foundational principles to guide nursing decisions. You want to have an open dialogue with patients, families, and interdisciplinary teams to support ethical clarity. So that leads to open communication and collaboration with everyone involved, and then peer and supervisor guidance. It's always good to consult your colleagues to explore alternative perspectives and ensure alignment with policy and law per state and organization. In the conclusion, we just have some highlights here. Ethical dilemmas are common in nursing and require thoughtful decision making. You have to remember your core principles: the autonomy, beneficence, non maleficence, justice, and fidelity. These all guide ethical actions. Nurses must balance their own personal beliefs with professional responsibilities and legal requirements. Ethical decision making is strengthened through models, communications, and institutional support. And then continued ethics education is essential for quality care and professional growth. And here are my references. Thank you for watching.